Good afternoon, everyone. This is Andy Reese with Department on Disability Services. Um, just wanted to first share the data with people. And then we did receive one question, so we'll get that. And then any other questions that people have for us today, we'd be happy to respond to. As usual, our colleagues from DC Health are here to help us respond to any questions related to them. So unfortunately, we do continue to see an uptick in the number of people who are testing positive for COVID-19 amongst the people that we support. Currently 364 people. And I think that I mentioned last week that unfortunately does include 2 people who had tested positive in April, recovered, and one tested positive again in December and the other one in January. So in terms of by COVID infections by placement type, in intermediate care facilities, we have had 111 people. In natural home, 41. In an out-of-state placement, 4. In supported living, 166. In host home, we have had 2. No, I'm sorry. In host home, we have had 6. In a nursing home, we've had 2. In a mental health facility, 1. And in residential habilitation, there have been 33. And as you can see from the chart on the left, if you look at those rates in comparison with, we in the agency, while there have been 41 people who are in their natural homes, that's out of about 930 folks overall, out of about 2,400 who are supported. And the same way, while the largest number of people who've tested positive are in supported living placements, that is also the largest percentage of people that we have. That's the plurality of folks are in supported living placements. So that high number does not necessarily reflect a high percentage of people in supported living. But as you can see here, in intermediate care facilities to date, what we've seen is 37% of folks who live in intermediate care facilities have tested positive, followed by 30% of folks in residential habilitation, 17.8% in supported living, and 4.4% in natural homes. Overall at DDS, it's been 15.15%. We have seen of the people who have contracted COVID, we've had 44 who have died, which represents in intermediate care facilities 17%, in natural homes 12%, in residential habilitation 9%. So it's 9% of those with COVID died. It's not 9% overall.
Director Reese, your slide has not moved from the very first slide.
Thank you. Wonderful. There we go. Sorry about that. So I'm advancing the one I'm reading, not the one you're seeing. So as I said, 37% of folks in intermediate care facilities have tested positive. And of those who've tested positive, 17% have died. Of those that have had confirmed COVID diagnoses, it's been 10.8% who have died. In natural homes, we have seen 4.4% who have tested positive. About 12% of those people in natural homes who contracted COVID have died, and all of those were COVID related. 30% of people in residential habilitation placements have contracted COVID. Of those, we have had 9% who have died. 6% of those have been confirmed as COVID related. In supported living, 17.8% of folks in supported living placements have contracted COVID. Of those with COVID, we've had 9% who have died. 7.2% of those, it was confirmed as COVID related. Overall, amongst people supported by DDA, 15% have contracted COVID. Of that population of people, which is 364, we've had 12% who have died, and 9% of those have been confirmed as COVID related. So in the month of January, in terms of COVID infections by placement, what we've seen is 9 in ICFs, 9 in supported living, and 4 in natural homes. This is a real increase in intermediate care facilities. In December, we had none. Unfortunately, you can also see from this chart in December or in November, we had 16. Unfortunately, what we see is when a person in a congregate setting gets COVID-19, it does seem to spread throughout the facility by the time it is caught. And so, you know, those 9 are just 3 different placements. There were 4 people in one placement and 4 people in another who have contracted COVID. So of folks who have contracted COVID, who have required inpatient treatment, to date, it's been 135. In January, there are 6 people who have contracted COVID who have required inpatient hospitalization. And in fact, at this time, there are 6 people who are in the hospital. So to date, as I said, 44 people have died. 44 people who have contracted COVID have died. We have gotten updates from the Office of the Chief Medical Examiner. 7 of those were confirmed as not being COVID related. COVID was not listed as the cause of death. And for 4, we are still awaiting a final cause of death. And so at this time, the total people who have died from confirmed COVID is 33, which includes 4 deaths that we saw in December. I'm trying to stop. So we did have, there we go, over here. We did have one question last week that unfortunately somehow we overlooked. So I will go ahead and read that for you now. Please review how people may go into the community. Some providers are not allowing people to walk on the grounds of the home, are only allowing people to walk on the grounds of the home. Also, if a person tests positive in the home, is the person who has already had COVID-19 required to get retested? Providers are still taking individuals to medical appointments when there is no immediate emergency or in-person visit required. So I'd call that about 3 questions, actually. And I'm also going to say Daryl is with us, and if you'd like to jump in and amend or supplement any of what I have to say, I would welcome that. So let me just clarify. So some providers are only allowing people to walk on the grounds of the home, keeping in mind that for intermediate care facilities, there is still guidance from DC Health that says that people who live in intermediate care facilities should only be going out for essential appointments, like an essential medical appointment. And so if this person lived at an intermediate care facility, I could understand how this could occur. Those same restrictions do not apply to other folks. And so if someone is in supported living and they're being told, no, you have to stay at home, there is no stay-at-home order in place at this time. And the same kinds of discussions that should be occurring naturally and all the time need to be happening now. Everyone has the right to make choices about where they go and the activities that they engage in. And, we have established the community participation assessment and questionnaire to help with guiding that. We have had a number of the discussions about people's rights during COVID with both providers as well as with the habilitation court attorneys and guardians. We will be starting soon, and if Emily's here, maybe she could provide me the dates. We will be starting very soon to have these same discussions with family members and the people that we support. So people, I appreciate how difficult this question feels in terms of feeling the need to protect someone versus a person having their rights, but it's the same kind of struggle that every single one of us is dealing with right now, and the people we support are no different than the rest of us in that regard. Wonderful. So Emily and Carol Grigsby have already done 2 rights training for family. There are upcoming ones on January 19th and February 8th. So if a person tests positive in the home, is the person who has already had COVID-19 required to get tested again? As I reported earlier, we've had 2 people who've gotten COVID twice. So I'm pretty sure, Daryl, that the guidance is if a person has had it within the last 3 months,
yes,
not requiring it, but perhaps you could address what the guidance is about testing for a household member of a person who has COVID.
Oh, okay, yes. So if an individual has tested positive for COVID-19, they should not be tested again for 12 weeks after that positive result, unless if they develop new symptoms or worsening symptoms, they should be evaluated by their medical provider to try to understand what's the cause of that symptom, and only through that consultation, but they should not be generally tested again otherwise. The other question, I think you mentioned, Director Reese, about household members. If there is, and I'm so sorry, can you give clarification on household members, and what's the specific question on the testing?
If another person tests positive in the home and a person who already has COVID lives in the home, should they be required to get tested again?
Oh, the answer again is similar, which is if they do not have new or worsening symptoms and they're within the 12 weeks since their last positive result, they do not need to get tested again. And part of the reasoning for that is that there are individuals who continue to test positive after they have recovered from COVID-19, and the positive result is not because they are continuing to be infectious or that they have an active infection. And we have seen that, and CDC has discussed this in their guidance as well. So if a person was positive previously and it's within 12 weeks, and another individual in their house within that 12 weeks becomes positive for COVID, that person who is still within the 12 weeks of testing positive previously does not need to get tested again unless they develop new or worsening symptoms. And at that point, we don't even say test them automatically. We say have them talk to their medical provider. Thank you.
Thank you. And then the last part of the question, people are still taking people to medical appointments when there's no immediate emergency or in-person visit required. So I think we've addressed this a lot, but I think it's essential that we address it as often as necessary to make sure that people are clear. Routine medical care that people get, they should continue to get. People who have underlying chronic health conditions need to make sure that they're receiving whatever care they need for those health conditions. There is none of us who should go. I mean, it's going to be at least 15 months, most likely, 15 months without seeing a physician if we have regularly scheduled appointments with that physician to monitor a health condition. It is essential that the people we support continue getting whatever routine, regular medical care they were receiving prior to COVID. With this caveat, they have a healthcare provider. That provider should decide how that care is provided. So if it is that their doctor says, I can do this via telehealth, then it should be done via telehealth. And for people who are in ICFs, we should be checking before we go to see if that's what the doctor approves of. If the doctor says, I need to see you in person, or I can do the appointment via telehealth, but then I need you to go get blood work done, that's what we need to do. I cannot emphasize enough. People need to ensure that their underlying health, protecting people from COVID to have them die from heart disease is not a success. Anyone that has any underlying health condition needs to make sure that they're in regular consultation with that healthcare provider and receiving the care they need, which includes dental care. So we need to make sure that people are getting whatever routine healthcare they need, consistent with the recommendations of the provider of that care. So there's a question about whether face shields are mandatory for DSPs in supported living, companion services, and in-home support. Can I defer to DC Health on that?
Yes. Hi. So we have two guidances that addresses personal protective equipment, including universal eye protection. One is personal protective equipment required at healthcare facilities, but in addition, for supported living and community residence facilities, CRFs, we do have a specific guidance for that setting. And what I will say is, in the personal protective equipment guidance, it does specifically say that it's mandated for those that are licensed healthcare facilities. However, because in the supported living guidance, that guidance states, in addition to universal masking, staff must wear eye protection, goggles or face shields in care areas and any staff areas where 6 feet of distance is unable to be maintained. So that's a long-winded answer to say, for supported living, the guidance that's for your specific setting and for CRFs outlines that it is mandated. So DSPs must wear eye protection in that setting. And I think the other question was for a different setting, Director Reese, and can you remind me?
That would be in-home support, so it would be the same as what would be required of like a home health aide or a personal care attendant who goes into a person's home.
Okay, so so I guess it would depend if it was a personal care aide that's being provided by a home health agency. They are also addressed in that guidance for required personal protective equipment in healthcare facilities. It's and it does address home health agencies in that guidance as well. So the answer is yes. You have to wear it. Thank you.
So thank you very much for people who are on the WebEx via computer. There are links in the chat box if you would like to register for the discussions for family and people we support on either the January 19th date or the February 8th date. It says last week in discussing vaccines for people with underlying health conditions, the question was raised whether documentation would be needed from a medical provider. Can you provide an update with any info if this will be needed? No. The answer that was provided last week is the same answer that I would provide this week. That question was raised in the call on Monday with DC Health. The guidance that DC Health has at this point in time is that underlying health conditions will be defined as underlying health conditions as determined by your physician, but they are not clear yet on exactly what, if any, documentation would be required at that time. So that is in group 1C, I believe. And so, so they are still working out exactly documentation, if any, would be needed when people get to that particular group. I'm just, now that I'm not sharing my screen anymore, I'm pulling up the most recent guidance, which identifies exactly where people with underlying health conditions fall. There is still a little time before we get to people with underlying health conditions. As people may be aware, any district resident age 65 or older I was going to say can log on, can attempt to log on and register to get a vaccine in the district based on the availability of vaccine. And so that became available on Monday, and people signed up for those pretty quickly. We have also been coordinating with DC Health, and we've provided them with the locations and the number of people who are in intermediate care facilities and residential habilitation placements in DC and Maryland who will need a vaccine, and they are working with us, with the providers directly now to identify where those people will go to get the vaccine. So the guidance that Daryl was referring to has also been placed in the chat box regarding the use of eye protection and the guidance about supported living. So if people would like to go directly there. Also, just as a reminder, all of this guidance can be found at coronavirus.dc.gov under DC Health guidance. And it may be, I'm pretty sure that Karen Stringfield is with us, and maybe you have an update or could supplement the answer I've given regarding vaccines at this point in time. So I see you're off mute, but we're not hearing you yet. Or maybe it's me. Okay, so if Karen can resolve that, if she has any update to that. So the next person, I'm sorry I missed the previous meeting about vaccines. An administrator for a day habilitation program for adults with disabilities. I understand that our employees are eligible for phase 1A of vaccine distribution as a healthcare provider. Can you please confirm this? That is accurate. Can you walk us through the eligibility process for adults with intellectual disabilities to receive the vaccine? So healthcare providers are in Group 1A and have received, the folks who are providing supports for people with DDA. We've sent something out to all of our providers about how they can register to get the vaccine. So for the people who are supported by DDA, at this point, we are up to providing vaccine for people who live in what are being defined kind of broadly as the long-term care facilities, although certainly residential habilitation is not in that category, but everyone who is in a congregate setting with DDA, which is intermediate care facility or residential habilitation placement, we have provided those numbers to DC Health so that they can coordinate with them to get the vaccine. The other folks who are supported by DDA would sort of be in line consistent with kind of the particulars for that person. So to the extent that person is considered by their physician to have an underlying health condition that places them at higher risk, then they would be in that group. And so at this time, we are at so as people may be aware, they're rolling the vaccine out in phases. Phase 1 was all healthcare personnel, fire and emergency medical, frontline public health workers, as well as long-term care residents. Phase 1B includes people in intermediate care facility and the residential habilitation, as well as people in homeless shelters, group homes, people 65 and older, and continuing to provide the vaccine to people in long-term care facilities, as well as Group 1B in Tier 1 includes correctional officers, and then non-healthcare personnel supporting operations of vaccination clinics. Phase 1B goes on from there to include staff working in schools, law enforcement, staff in childcare facilities, grocery stores. And then beyond that, it would be a number of other staff. And then Group 1C would be people 16 to 64 with a chronic medical condition with increased risk of complications for COVID-19 and or a chronic medical condition as defined by their healthcare provider. And as I said, I have that definition at this point, but DC Health has not finalized yet what documentation, if any, they will be requiring for people in that category. So for many of the people supported by DDA who are not in an intermediate care facility or a residential habilitation placement, if they have an underlying health condition, or if they have a physician who determines that a developmental or intellectual disability, an intellectual disability is a chronic condition that places them at increased risk of complications, then they would qualify under Group 1C. And then, 1C has the same sort of, there's tiers of people, and then you get to phase 2, which is essentially everybody else. Someone who doesn't have who doesn't work in any, in any of these fields that place them at higher risk, or have any underlying health issues, would be then in phase 2. How many people are now in ICFs and ResHabs? Total is about 400. There's just under 300 who are in ICFs and just about 100 who are in residential habilitation. So people who are supported that are in ResHab but live in Maryland, we have reached out to all residential habilitation and intermediate care facilities to make arrangements for them to get the vaccination in the district. The district has made sure that all district residents, as well as the people providing care to district residents, have had access or will have access to the vaccine in the district. So I don't know if this is a question or just a statement. I know the percentage of people in supported living who have contracted COVID-19 is about half that compared with those living in residential habilitation. But the percentage in those placements who have died from COVID is comparable or slightly higher in supported living. I wonder if that is being considered in prioritization. So, when the prioritization was done, we provided all the data to DC Health and spoke with them about which groups would be included as 1B versus 1C. And the decision was made at that time that it would only include those in the what I would call sort of larger congregate settings, because supported living, if you're living with one or two other people, you could consider that congregate. And so, yes, all of this data was shared with DC Health, but I think that part of what was, I expect that part of what made the decision was the significantly higher risk of contracting COVID-19 in the larger congregate settings. Not only that, when you start to look at the numbers, you're talking about well over 900 people in supported living. And so you weren't just, the initial plan was for intermediate care facilities. And so then we were able to include also residential habilitation and also residential habilitation in Maryland, which, as I said, just added about 100. To then also include just another 900 was not something, unfortunately, that was possible based on the numbers at that time. So I'm seeing here a list was requested for ResHab only for those living in DC and not Maryland. That should not be true. And so I will confirm that as soon as this is over. Actually, well, yeah. So what was requested, trying to think of, the days are kind of running together, about a week ago, was that a spreadsheet be completed for all ResHabs and ICFs. And I think we were pretty explicit to say DC and Maryland. And if Karen is available there. So for folks who did not submit those Maryland numbers, those really do need to be submitted. I'll go back and look at the communication that was sent, but either way, just to clarify, it is all. Now, I will say a few weeks ago, we asked for the numbers of people just in the district. But last week, we sent something out to all providers of residential habilitation and intermediate care facilities, asking them to complete this spreadsheet and submit it to DC Health. And I was told that everyone had submitted to DC Health. So we'll check to confirm that that's accurate and get it back out to folks. So We should direct adults to go through their group homes if they live in residential facilities. Those that live in natural homes or supported independent living may be eligible for phase 1C, depending on medical vulnerabilities or age. Intellectual disabilities alone do not make someone eligible for a priority phase of vaccine distribution. So up until that last sentence, I agree with you. And Karen's here, but I'm not sure she's able to speak. So maybe there's not someone who can say, no, that's not correct. But let me just say, first of all, that is true. If someone lives in a residential habilitation or intermediate care facility, then that provider should have already submitted not their name, but the numbers to DC Health, because they were then going to identify where the vaccine could be provided for those people. Those in natural homes or supported living may be eligible for 1C depending on their health or their age. That is true, because people who are 65 and older, and I looked at that number the other day and I don't remember off the top of my head, but we do have quite a number of people who are not in ICFs or residential habilitation who are 65 or older. And we did send something out to everyone reminding them that they should reach out to those people to say that you can register now and to provide them the support they need in order to register, because starting on Monday, and the communication did go out on Monday, that folks 65 and older, regardless of where they live, can register to get the vaccine. As I said, the definition of 1C from DC Health says, as defined by their healthcare provider. And there is some evidence out there to support a healthcare provider who would make the determination that this person is at increased risk based on having an intellectual or developmental disability. So that is a determination of their healthcare provider. Whether a healthcare provider would say that or not, I can't say. It is not listed explicitly in any of the guidance I have seen from the CDC that an intellectual disability places you at higher risk. The challenge that people we support have is that many of them do have sort of co-occurring disabilities that do place them at higher risk. And that's the reason that people with intellectual and developmental disabilities may be in that higher category. But I've also seen some research that says that people with particular disabilities are at higher risk. And as I say, the guidance from DC Health at this time says, as defined by their healthcare provider. And as we hear from DC Health about what kind of documentation will be required, we will keep people updated. So there's a question, is DDS tracking the number of provider staff who have been vaccinated? If so, how and what is the number so far? We are not tracking staff at this time. We have asked providers to track their staff, but we are not tracking it at this time. And I will say, for providers to track staff is challenging as well because, they can't require staff to get the vaccine. And so they can't necessarily ask for evidence that they have the vaccine. And just as a reminder, as that comes up, and this was said last week, but I don't think any of these things can be said too often. The vaccine is an extra layer of protection. It's a layer of protection for the person who gets the vaccine, preventing them from getting ill from COVID-19. It does not mean that staff would take any fewer precautions regarding the risk of transmission of, the safety precautions that we should all be taking, regularly washing our hands, wearing face covering in the appropriate setting, wearing a face shield. So it really maintaining safe physical distance from people when possible. So, it is essential for the time that we continue to stay vigilant about implementing those practices. It's interesting. I heard on NPR on my way in this morning that while mask usage is up, hand washing seems to be down. Just as a reminder, it's also flu season, and washing your hands keeps you from getting the flu too. But regularly washing your hands for at least 20 seconds with soap and water if you have it, and making sure that you have a mask on whenever you are around other people, around non-household members, and, as I said, for staff in our placements, following all the DC health guidance regarding personal protective equipment. So some staff are having difficulty registering for the vaccine. The website says there are no appointments. Someone addressed this earlier. Since I'm not someone who could register through that, what I will say is that you just have to keep trying. And then sometimes you are sort of connected to a particular provider and you need to go to a different one because they will have vaccine. I recognize that it may be challenging sometimes to get through that system, but I do know that last week the response to that question was that it was partly that individual provider did not have any vaccine at that time, and that when someone logged back in, either trying with a different provider or logged back in later, they were able to get it. So what I would recommend also is just checking with other providers who've been successful. If Karen is able to speak, it would be helpful to hear. I do know that there was significant demand this week for vaccine when, in 1B, it also opened up to people 65 and older.
Director Reese, this is Nelson, if I might interject. Also, just within, I do know that after they announced 65 or older, the website appointments for availability of vaccines were gone in a number of hours. And so it was people, I think, once that news was released in Mayor Bowser's press conference, immediately went to sign up. But there's also a phone number there that you can call to try to get in and see if you can sign up that way also. And then everyone is encouraged to sign up for the email and text alerts for when appointments become available so that they know when they can go immediately and sign up.
And so, unfortunately, the provider staff that we have in DC could begin registering right after Christmas. And so, this week was probably not the best time to start trying to log in to get the vaccine because, as I said, there was such significant demand. I do believe we're about to see some loosening of the vaccine that's out there so that we should see a lot more in the system. So as Nelson said, there is that alert system that you and someone type this in. DC Health will send you a text when registration opens back up. This is a tremendous undertaking. There are 700,000 residents, although they're only seeking to vaccinate 16 and older. But in addition to that, all of the healthcare providers that work in the district. So, I think that DC Health is really doing a tremendous job of really putting this together and trying to get the vaccine out there as efficiently as possible and doing its best to prioritize. So Carol has noted Carol Grigsby as chair of the DC Developmental Disabilities Council. You just want to underscore that we don't believe all people over 65 should have qualified for the vaccine ahead of people under the IDD waiver, that this was communicated in writing to Dr. Shah. Interestingly, the CDC this week then recommended that other states follow what DC had already done. So I think part of that was probably just that we are not seeing vaccine, is that in some jurisdictions, the vaccine is not getting out. I don't believe that's a problem in DC. The problem seems to be that we just don't have enough vaccine yet. And, each week, some more comes in. And so they do their planning as they are able based on the vaccine that comes in. Is DDS planning to track the number of people supported who receive the vaccine? I'm going to defer to you, Winslow, to talk about how we track people supported in terms of healthcare they receive.
Sure. Every person supported in a residential setting, to include ICFs, ResHabs, supported living, and host home, is monitored for the compliance, what we call compliance with recommended immunizations. And that typically would be the vaccinations, the flu, MMR, and other annual vaccines. And we intend to include this vaccine in that process because we think it's important to know who has been receiving vaccines, not just the COVID vaccine, but we do track this. So we should have an easier time tracking this because of the attention that it's been getting.
So there's Carol Grigsby shared a link to an article that was in, I thought that was this morning's post. It could have been yesterday's. I read it this morning. So Could have. So anyway, that speaks to the issue of vaccine distribution in the district. And, so for people who are interested, you should click on that while you are still in this, because then you'll have access to read it after. So there's a comment here. It should be noted that some family members are not consenting to vaccine for people receiving services. So to what Winslow said, this should be taken into consideration for monitoring. And it certainly would be, I expect. But Winslow, you could speak to that. I mean, people have a choice about whether to get this vaccine.
Yeah, so as with any medication or vaccine or any procedure that a person or the person's guardian deems as something they don't want to take or participate in, we're limited in what we can do, but we certainly do have that documented because, you know, as most people don't know, maybe they do, that whenever someone that we support expires, we have what's called a mortality investigation, and those deaths are reviewed at the Mortality Review Committee, for which I sit, and then the mayor has an order for a DC Fatality Review Committee for people that we support, which I'm co-chair. So there's an investigation, there's a review internally within DDA. Those findings are then submitted to the citywide Fatality Review Committee and reviewed. And we're very involved in this in the sense that whenever there's an outlier or a variance for what's recommended with regard to a person's health, we want to be able to cogently be able to speak to that to any external party who questions a decision as to why someone didn't receive something. So we're mindful of that. Thank you.
Winslow, could you speak to if a person chose not to, for example, you know, at particular points in our life, they recommend different vaccines that a person get. A certain age, you get pneumonia vaccine, you get the shingles vaccine, that a doctor recommends that you get the flu vaccine each year. If a person is not receiving any of those that are recommended, how does health and wellness or service coordination address that?
So the first thing that I would like to explain in response to that, that's typically dealt with from the clinicians on the provider side. And then when we find out that this is what's happening, the guidance is to ensure that the guardian or the person served absolutely understands the risk and ramifications for not complying with the recommended vaccine. And then that's documented because, as I said, people have choice, but we have to be certain that they are making an informed choice. And we ensure that the providers actually support that by providing information. Because sometimes people, like with this vaccine, as you stated several calls ago, or maybe even further back than that, people have fear of the unknown and they may not take it. And sometimes that fear is cultural. Sometimes that fear is based on information that they've received. And so the main thing is to make sure a person is informed and that it's well documented that efforts to educate them have been provided. Because as we stated, we can't force a person to do something.
And that I expect would be handled the same way for this, which is education would be provided, and we would make sure and document the decision maker's ultimate decision after receiving that education.
Yeah, I think you really hit it on the head because, as I said, you know, one of the most challenging things to do is to explain something a year or 2 years after a decision is made without the benefit of having solid documentation that the person was supported well, ensuring that they understood the risks, benefits, ramifications of their decision.
So it is now 1:00. It's 1:01. We seem not to have any additional questions. I want to thank everyone for participating this week. Let's hope for a quiet week, a quiet, peaceful transition next week to a new administration. And we will be talking to everyone next Friday. Thank you very much.
Can I just say, earlier today for the Fatality Review Committee, there was a discussion about ensuring that we make a very intentional effort to explain to those that we support about the goings on, within the district. People are being bombarded with stuff on TV with a regular basis, and as people are home, they're probably watching more than usual, to ensure we explain to support people's understanding of what's going on. Thank you.
Hi, this is Crystal. I just wanted to remind everyone of Project Action's meeting tomorrow at 10 o'clock. I don't have access to the link, but if Emily, if she has access to the link, if she can put it in the chat box just for everyone before we sign off.
I can, there she did it. Okay.
Now, shouldn't they cut and paste that? Because once you shut this meeting down, will that go away?
Absolutely. People need to copy and paste that link.
Yep, it's tomorrow at 10 o'clock.
And I was made the host, so I think as soon as I go away, it goes away. So I'm going to leave this open for a couple of minutes so that people have a chance to copy and paste.
You have a question. I've been told there will be consent forms. Question on consent. From what we know, there has not been a consent form as much as there's been information about the vaccine shared with people. And if Danielle's able to be unmuted, I'd just like to have her speak to it, because I think she has a bit of experience with the people that they support who may have received it, or the staff as well who've received the vaccine. I saw Danielle. Not to put you on the spot, Danielle.
She's not here anymore. Right. What we were told by DC Health is that you were given an information sheet about the vaccine, but not a required signed consent. So, and just as a reminder, because I don't see that, well, it's too late now, but we'll remind people in the future, please make sure you send your questions to everyone, because I didn't see the question that was missed, and it may have gone to.
With regard to mom's question, as a mother and guardian of my son, age 48, who is in supported living facility, will I have to sign a consent form for him to receive the vaccine? And then Carol follows, as I was told, there will be a consent form to sign an SL. What I can say to you is that lots of providers, in an abundance of caution, have, how can I say this, developed or required consent on various vaccines. And this is, I would suspect, to ensure that if there are reactions or after the fact responses, that they have done their diligence to ensure that the person making the decision to receive and or give permission for the vaccine to be administered understands all of the information around the vaccine. If I were to go in, I likely would not have to sign a consent. But if a provider were supporting me and they were concerned that if I took the vaccine and had complications, and then a family member might, after the fact, wish to seek some sort of action against me for doing that. And we've had that happen, unfortunately, where people say, well, I never signed for that. Well, if it's not something that you have to sign for, why would you need to? But I think providers, out of abundance of caution and liability risk, have those consent forms. So you may likely, Mom, have to sign that consent. If you
So unfortunately, like with, I think, everything else COVID related, we are very much learning as we go. I can tell you what we've been told so far. And over the next week or two, I'm hoping that we will see all of our folks who are interested in intermediate care facilities and residential habilitation get the vaccine. And as we see how that process works, we'll then be able to provide an update on exactly how that worked. And then people will know what they can expect for the people who are in supported living or living at home. Okay, thank you very much, everyone. Have a good day.
stay safe.
You're still on, Winslow. Just
What does that mean?
FYI.
No, I'm